Welcome to MedRN's Medication Management in Aged Care Refresher DVD. This is a two-part DVD series that will be covering a variety of topics on medication management in aged care, with the aim of revising medication management knowledge that you have previously gained and to maintain the safe, effective and correct use of medicines. The older population are the largest consumers of medications, both prescribed medicines and over-the-counter medicines as well. You think of the progression of chronic diseases, the complexities of multiple conditions, and inevitably polypharmacy results. The potential for multiple medicines to cause morbidity is great, but the opportunity to improve is also great through revision and an awareness of ways to continually improve so that nurses can perform their role with confidence and safety and achieve outcomes for their residents. As people grow older, their response to medications can change. This is due to two major mechanisms which we call pharmacokinetics and pharmacodynamics. These age-related changes must be understood as they can significantly alter medication response. Consequently, some medicines may require dose alterations or avoidance totally because of the toxicity that they can have in the elderly person. So what is pharmacokinetics and pharmacodynamics? Dose administration aids, or what we call blister packs, Webster packs or dose sets, are aids to be used for the purpose of overcoming potential problems with compliance or confusion with medication. It is important to note that medicines packed in dose administration aids are medicines that have been prescribed, that is written up in the patient's drug chart and is part of his or her regular regime authorised by the treating doctor. There are, however, some medicines that should not be packed in a multi-dose administration aid in combination with other regular medicines. These include PRN medicines. These also include unstable drugs that should not be removed from their primary packaging because they may react with heat or air or moisture and cause an instability of the drug and a breakdown of the drug. Oral dose formulations are perhaps the most common dose forms prescribed because of their convenience and their cost. In aged care, however, in many patients, swallowing difficulties are encountered, and swallowing of these medicines become a real problem. For these residents, crushing their medicines are often necessary to aid swallowing. However, it is vital that care is taken to ensure that this process does not cause negative effects on the patient. Some negative effects that is a result of crushing of medicines inappropriately include reducing medication effectiveness, increasing the risk of toxicity, and tolerability due to altered taste and texture of the medicine. Let's discuss the 6-step process as proposed by the APAC guidelines for medication management in residential aged care facilities. When I ask nurses which resource they go to for information about medicines, whether it be drug interactions or adverse drug reactions, they usually tell me MIMS or ENs. Remember the hard copy, quick reference MIMS that were just the right size for the drug trolley. As health professionals, we need to speak one language when it comes to medication information. MIMS is a fantastic resource. However, it is important as clinicians, as healthcare providers, to be aware of other resources that are also available to us so that we can get a variety of evidence-based, credible information. It is important when referring to medication information that we are using up-to-date editions that are evidence-based. This will help you to meet your duty of care as a health professional, knowing that you are confidently backed by credible resource. So let's take a look at some of the resources that you can access, some of which may require subscriptions, but there are some really good credible information that are free. The area of medication management continues to evolve and change rapidly. It is important that we continue to stay up to date with how to manage medication effectively for our residents. MedRN are here to help you do that. MedRN are committed and passionate in supporting you in your medication education needs.